authenticity in marketing has become such a foreign concept, where it's become about numbers and it's become about revenue generation and money, money, money. And that particular concept is so removed from especially the mental behavioral healthcare market space that it's just not going to jive. And so you can't expect to put out there a personality that only cares about money, revenue, all that kind of stuff, and for that to jive with the voices of people who are doing things because they're passionate about it, because they care. They're really trying to make a difference in the world. And like we've already discussed, I don't care about the money behind it. And so how can you have to adopt the exact same mentality and actually care about the person you're going to talk to.
All right, welcome to The Boost, conversations with people promoting mental health. And I'm here with David Henderson, the Director of Marketing at Mend. David, how are you?
I'm doing great, Steve. Thanks for having me on.
Yeah, definitely. It's great to have you on the show. We're about 50 episodes in. I don't know which one this will land on exactly, but it's cool to be doing this. Have you been on a podcast in a while, or do you do a lot of these?
It's been a minute. I ran a podcast a while ago, and so I know some of the things, but it's been years. So this is new, but congratulations. Now I've seen some of your episodes, and you guys are doing some really great work.
It's so cool to
Yeah.
run into people like you and all the people I've talked with. It's just amazing when you sit down eye to eye and get to chat. So I'm looking forward to our conversation. I'm looking forward to the shameless plug, people learning about Mend and your feature suite, which is robust. We could talk about that the whole time. But before we do, we're going to do the virtual hug before we do the shameless plug. So tell us somebody or something you're grateful for today.
Sure. We kind of talked about this beforehand, and the first person that came to mind was actually Danielle Kynes, kind of your partner in crime for the Mental Health Marketing Conference.
Yes.
It's so funny. I met Danielle via LinkedIn before the NatCon conference earlier this year and connected with her. And then out of nowhere, this person came to my booth and I was like, I know you. And she's like, I'm Danielle. I'm like, we just connected on LinkedIn like 5 minutes ago. And she was like, yeah, that's me. Do you know about the Mental Health Marketing Conference and all this kind of stuff? And so I, being part of marketing, got real excited about it. And it's just been really good ever since. But what a great person. And so I owe her a lot of gratitude for the work she's doing and how she's helped us kind of get plugged in. So thanks, Danielle.
She's been that's mine too. Danielle, you get a double shot of gratitude today. She's been working on the conference 2 years. She makes things happen. That Danielle, and she was based in St. Louis, so NatCon, perfect location for her. We were like, you got to go to NatCon. This is like one of the best conferences of the year. And she met so many people, which does, from our incentive standpoint, reinforces the power of events. Of course, we're like, hey, this is where it works. But we had never talked with you before. We've been doing this
Right.
8 years. How long has Mend been around?
So it's an interesting story. Mend's been around since 2014 and has initially was serving all kinds of healthcare verticals. But here in the last couple of years, leadership decided we need to get focused. Where do we have the most passion? What's the most meaningful vertical to us? And it's just been the last couple of years that we turned our focus solely and specifically to mental health care. So it makes sense if you haven't heard of us. However, if I'm doing my job right, you will.
Well, we heard of you this year, but it's the same for us. We've been doing this
Yeah.
since 2016, and this year and last year felt like the first time where most everybody had heard about us in some form or fashion, but we're still meeting new people. I had a conversation yesterday with somebody who said, "Oh, you need to meet this person who's officing out of our space," and it was a psychotherapist. And they have like 1 million followers on Instagram and 2 million on TikTok. And I was like, well, I haven't heard of this person, but I'd love to, So it just keeps coming in, and it seems like we're attracting just really cool people, like you, who just learn about us when the time's right. So we're
I
stoked to hear,
gotta
your
I gotta
strong.
agree with you there that this
Yeah,
market is just full of cool people.
yeah,
Um, where, I've worked in other markets before, and there's a little bit more hesitancy to get to know people, to create relationships, and some of it may just be the nature of the market and the people that work in it. But it's just more friendly.
I agree. It's like especially collaborative and open. We try to, of course, design our conference experience that way, but I don't know how much of it is our intention versus it's just the community that shows
Yeah,
up. And you could be a keynote speaker, or you could just be a first time attendee, and there are almost no walls or barriers between organizations, even competitive organizations. We attract some marketing agencies and graphic design firms who are doing similar services, at least from the outside looking in, and we've seen them collaborate, or at least strike up friendships, which is
yeah,
always wonderful to see. There's something bigger than business that we're working on here.
right, right. Love that.
Well, let's make sure we touch on the shameless plug.
Sure,
Tell us about what Men does, and take your time with it. I'd love to hear from you.
sure. So Mend is all about patient engagement. Our mission is to make access to mental and behavioral health care accessible for everyone. And that's on both sides of the equation, whether it's administration or the providers themselves, and patients on the other side of that equation accessing healthcare. That's been a tricky road for lots of reasons, right? Whether it's stigma or demographics, there's a million things that can keep people away. And I think even more complicated than other areas of healthcare, where there's not a whole lot of stigma around cardiology. If you have a heart attack, you need help. However, if you have, a bout of depression, there might be people in your life that are telling you, well, that's not real, just get over it. And you just don't have that in other sectors. And so there's this added challenge, along with, my own personal story. I have two children who've been diagnosed with autism. But had I not, one of them was 14 when we even got the diagnosis. We had no clue. And so that's it's kind of driven us this direction. Everybody at Mend has kind of a story connected to mental and behavioral health care. So the idea of making access more realistic globally is just what drives us. So for that reason, we've created a suite of patient engagement tools that allow these two groups to get connected, despite the barriers that come up, in ways that, EHRs, EMR systems have attempted to do. Unfortunately, for a lot of EMRs, it's difficult to pivot and focus solely on one space. And that's kind of where Mend comes in, is we fill in this gap where we are focused solely and specifically on mental and behavioral health care. So while we are not at all a replacement for the EHR, but we do have, for instance, portal-free patient engagement. And so if your EHR already has a portal, we don't create another portal for patients to try and log into. We actually cover the 50 to 60% of patients who may not successfully be using your portal, and give them access to you in a different method, right? So
I noticed that. It was like 30% is kind of the average for a patient portal. I'm definitely in the 70%, but
yeah,
how do you drive that to 90%? Like, what's the secret sauce that, if you can share, about how you make that different?
sure. I mean, at the very basic level, it's a patented methodology that Mend owns, which is, instead of remembering a username and a password, all you have to have is your device and remember your date of birth. And so logging in with date of birth is what makes that really convenient and accessible. The funny thing is, I'm in the 30%. I have no problem logging into a portal with my primary healthcare provider, right? But a year ago, I had surgery, And now I had a portal with my primary healthcare provider, but then there was a whole other portal for my surgeon, and there was a whole other portal for anesthesia. And now I'm part of this. I hadn't thought I was going to be in the 70%. And some of it was just because I had portal overwhelm. So that's another piece of the, I want to, gum things up more than they already are for the patient. And so the date of birth access makes it quick and easy. And I think that's probably the best way to explain it, is just simple access tools and finding ways that you can still be 100% secure, but at the same time, get easy access to patients.
Yeah.
Yeah.
So you're connecting relationships across both sides, patient and clinician. And with your own personal story of, children with autism, the additional stigma that they can face sometimes, is tremendous
You
and
bet.
complicating, not to mention the other, social aspects and the other psychological and biological aspects that, make mental health such a healthcare issue and beyond.
Right.
I used to say, mental health is health, and it's like, well, actually, that's true. And there are kind of ethereal or hard to get at aspects of mental health that make it, yes, a healthcare issue, but also beyond. And whether it's the health plan or the payer, like trying to pivot toward risk, kind of risk and managed care, or the EHR trying to pivot into behavioral health or mental health organizations that could really benefit, at scale or multi-site, mid-market, large organizations. While you're not replacing that, you are, to put it clumsily, greasing sort of the skids between
Sure.
those relationships and that information, and how to start to tie it together more closely.
That's exactly right. And I think, when you have those complexities on the patient side, those spiral together with the complexities on the provider side, where if the provider's passionate about the care that they're delivering, but somebody else can't get access or kind of refuses access through certain methods, we unlock the doors on both sides, right? So a good example of that is our digital patient intake, continuing the shameless plug,
Yeah.
digital patient intake, by which someone can, you can intake a patient digitally. They can use their smart device and check in. They can fill out their forms, their assessments, their screeners, before they ever get to your office. And you can track whether or not they've done that. And then we can use sophisticated tools to say, okay, have they completed these tasks that you've identified? And if so, what likelihood do we have that they're actually going to show up to this appointment? And if there's a lower likelihood, what activities can we generate? So now they'll get a text message reminder. Don't forget to fill out your forms because you have an upcoming appointment. Click here to confirm your appointment. These kinds of things, because they're really the two greatest problems that we're trying to solve right now at Mend is, number one, eliminating no-shows. If there's one biggest problem across the board, it's no-shows. We met someone at NatCon actually who came by the booth and we're like, what do you do? And we're kind of explaining, but our question is, what's your no-show rate? And without hesitation, he said, my no-show rate is 50%. And that's not rare, unfortunately. And that's mental behavioral health care just has a much higher average no-show rate than anywhere else for all the reasons that we mentioned before. So how do we eliminate that? Some ways are through digital patient intake and through digital forms and assessments, and then measuring behaviors to figure out, is this person going to no-show and how can we rectify that? Other ways are we support hybrid care. So maybe they can't come in person today. Maybe their ride broke down, or maybe the bus didn't show, or whatever it is to get to your facility. We also provide video visits. And the nice thing about the video visits is they've been designed specifically for mental and behavioral health care. So in the visit, you're not just doing this and then trying to turn to your computer or take handwritten notes or things. The notes are right there in your visit, right? And all of these things are integrated with the EHR, and we have a picture-in-picture mode so that it can live on top of your EHR, so you can be in both places at once. So it's these kind of small things that we're thinking about that, number one, make the provider's job and workflow make more sense, but also solve the biggest problem at the same time, which is if the patient can't come in person, well, just come virtually, no big deal. So
And these are
trying
the
to solve these problems, the other biggest problem we're trying to solve is provider utilization. So if we're canceling all kinds of appointments and things like that, schedules become irregular so quickly. And that means negative things for burnout. That means negative things for a sense of fulfillment about your work. It also means negative things for the practice and for revenue. And, inside of all of that, what you have is maybe this, I don't know how to make them compete. I think it's the same level of problem, and that is we can't pay our providers enough. Well, how do you start paying your providers enough? First of all, I think there's probably a bigger conversation that we're not ready for today, which is, well, spend your money on the right things. There's another piece, which is, well, you're going to need more revenue. Well, where does revenue come from? Well, we're going to backfill these schedules. And so Mend is developing a smart scheduler. And the smart scheduling will allow providers' schedules to be backfilled by people that are on the wait list. And now we have this kind of full environment of scheduled appointments, normalized revenue streams, things like that, that if we can commit to doing the right things with the money, at least we know the money's there.
That's wonderful. Uh, what a two-pronged solution. I know there's more that you offer and work on, but to those are huge. I mean, a 50% no-show rate being common in a world where we're howling for access
Right.
and there are wait lists, and then not only to solve for or reduce that dramatically, but also to be developing solutions that are going to be backfilling or in real time filling those gaps. I mean, yeah, in terms of one of the biggest complaints that I hear, which is the pay that therapists or clinicians receive sometimes, um, at a practice that's only going to do good. That's only going to bring in revenue for existing, overhead that's sitting there, a human, a person. And
Yeah,
I was going to ask, you don't source these clinicians for any of these video calls. You're the throughput, and it's the clinician on this side and then the patient on that side, but they can
that's
use
correct.
video. Okay. Got it. Okay. Fascinating. And then is there anything else, like any other, longest shameless plug ever? Is there any other features that you're either developing or that you're like really excited about before we move on to the next kind of set of questions? I want to make sure we hit on.
Sure. Sure. I mean, when we talk about digital patient check-in, we have video visits, we have digital forms, we have smart scheduling, we have an enhanced virtual waiting room when you do use video visits that you can stream your own content to. So they're not just waiting, they're getting valuable pieces of education. um, there's a whole there's a whole world of things that we're doing and things that we're developing. I think the most exciting thing is our roadmap, and to be able to partner with a company whose roadmap is focused solely and specifically on mental and behavioral health care. I think there aren't many better partners, and we have so many successful conversations based on that.
Mm.
And I think
This
it's
is
just kind of a welcome relief, more or
this
less.
is such an exciting example of a technology company helping to solve for scale, or helping to solve for access challenges, which is got other than payment, probably one of the biggest problems we're having. And you're kind of doing maybe perhaps some of both of those things.
Yeah, and we have automated patient payments as well, and so there's a lot of companies out there that are just not realizing revenue where they could be, and so we pick up there, and we have automated payments processes to see what we can do about realizing that revenue where it's not.
Hmm. So as a marketer, shifting to you yourself and as part of your role in the organization, We have a lot of marketers listen in. And from a conference perspective and also the podcast, we are attracting more technology companies generally. So, talk a little bit about how um, what you're doing to craft the brand, and we can talk about some things you're doing that you've seen work really well for you to drive traction on the marketing side. I would say this is definitely well, I don't know. This is a B2B play, but I don't know. There's also maybe a B2C component, or you tell me, like, what's your audience and what are you doing?
I would know we're definitely in the B2B space. And B2C might be like a realized dream come true one day, but right now we play solely in the B2B space. And I think when you get into B2B and then you move into healthcare and then you move into a niche healthcare, it is a totally different animal than most marketers are ready for. And if you don't figure out the puzzle correctly, you just have a mess on your hands and you won't grow and you'll wonder why and it'll be puzzling. So a lot of traditional marketing attempts are, we refer to them as spray and pray attempts, right? Just spend a ton of money and throw advertising out to the masses and things like that. And I would encourage companies out there who are doing that in a niche healthcare segment like mental and behavioral healthcare. If you're scratching your head and just budgets flying out the window and you can't make things happen, there's a reason. And the reason for that is that healthcare in general, and then niche healthcare specifically, has been starved for relationship. And what Mend is attempting to do from a marketing perspective is dramatically change all of that so that if we show up on your doorstep, that's not because we picked you out of a barrel of 50 million. It's because we've actually researched your company. We know your name and we already know we have something to offer you. And we think this is a good match. Even if it's not the perfect product match, we know that we're a good relationship match. And so our first attempt is to show you that we're passionate about your space, that we care about what it is that you as a provider company are doing. And we want that to be successful. And one of the biggest challenges I think that marketers have right now is to say that and get people to believe you, right? And kind of the reason behind that is because authenticity in marketing has become such a foreign concept, where it's become about numbers and it's become about revenue generation and money, money, money. And that particular concept is so removed from especially the mental behavioral healthcare market space that it's just not going to jive. And so you can't expect to put out there a personality that only cares about money, revenue, all that kind of stuff, and for that to jive with the voices of people who are doing things because they're passionate about it, because they care. They're really trying to make a difference in the world. And like we've already discussed, I don't care about the money behind it. And so how can you have to adopt the exact same mentality and actually care about the person you're going to talk to. And so, Mend, the marketing team at Mend is making a really diligent effort at doing just that. We work together with the sales team to show authentic care about the people we're presenting to, regardless of whether there's a purchase at the end of the day or something like that, because we still have value to offer to you, even if we're not in a specific business relationship. And we hope to put that across so that people will really know that we mean what we say. If you ever get a chance to be on one of our sales presentations, you will notice that our sales team starts with their own personal story about mental health care. And it may be themselves, it may be a family member, a really close friend that represents this experience in their mind. But the first thing they do is they open with that story. And the purpose there is to tell the people that we're talking to, you make a difference. And if you don't take anything else away from this interaction today, you need to know you've impacted my life, and that's a big deal. And for that reason, I'm not going to bring you something that isn't going to be of benefit to you, isn't going to be of value to you.
Hmm. Whoa, this that's tremendous. This may feel like a non sequitur. I'll make it quick, but I think it's actually really relevant. Is a friend of mine sent me a study on happiness, and in like Western societies, it's all about like mostly it's all about performance. It's all about like kind of the pay per click ad thing, and in marketing, we've sometimes lost our way for how powerful story can be, timelessly powerful, but for your reps to start with the story of themselves in our brains, there's like at least 5 or 6 categories that lead to our happiness. And if you focus on simply performance, um, achievement at work or ROI or whatever that performance kind of beaker may be, you can only fill that beaker up so much, but we
Right.
have these other combinations. We have dopamine mixing with oxytocin in our mind, or dopamine and opioids in our mind that connect us with kind of different things like relational, like friendships, or family connections, or gratitude and purpose, or simply recognition, being able to be seen. And it sounds like it makes me think when you do your marketing that you are filling up most all of those beakers, maybe other than family. You're not like going to do that, but it's a more comprehensive approach to uh, without manipulating someone, using that behavioral kind of experience, or just your empathy, really, to say, no, we're gonna start with the human here and my own story, and make these relationships happen, knowing that whether or not this is a perfect fit, we've done our homework to know this is a relationship we should have long term.
Right. Yeah, that's exactly right. We were really lucky to come across one individual, Brittany Lindsay. I don't know if you're familiar with Brittany Lindsay, who provides mental health care sessions for providers. And we were so inspired by her story. So now we've a good example of what we're doing in the background. And you won't see us try to, of course, here I am doing a shameless plug. And again, here's the complexity of trying to tell you what we're doing, but also be authentic at the same time. But we've partnered with Brittany Lindsay, and the criticism she was getting on, she was on LinkedIn and she was telling about what she does, and she offers these sessions for free at no cost to providers. Well, she got criticism from some other people, and it was both for being a provider, even being a female, and offering services for free, right? Don't offer your services for free because you are valuable, you need to be valued. And I agree with that, and I know she agreed with that. But then her pushback was, but as soon as I charge money, no one will show up. And so what was the answer? And so Mend has been able, right? The leadership at Mend were so cool about this. And the answer was, you know what? Why don't we sponsor Brittany Lindsay? And then she can continue this activity and support the providers. And I've been excited about that. Just it's been, singing the praises of Mend leadership. They've been very humble about it. They haven't put up big billboards or anything like that about it. It's just we authentically and sincerely want providers to thrive and to be well so they can continue doing what they're doing. And that kind of thought bleeds into our marketing, it bleeds into our product development, and hopefully becomes really, really clear, not only to our users, but to everyone that we kind of create relationships with.
Love it. Yeah.
Yeah.
That name sounds really familiar. I'm not going to look it up right
I'm
now.
sure she's a great writer. Highly encourage you to connect with her and read her stuff. She has a brilliant mind.
Nice. I'll check her out after this.
Yeah.
Well, thank you for sharing this space with me today.
Same to you, Steve.
Yeah, thank you. And thank you to Men for sponsoring the conference, bringing your voice and expertise to the conference, and then here as well. I really enjoyed talking with you today, and I hope we get to talk again soon, not just in October, but down the road.
I can't wait to see you there. We are so excited. We've got a webinar coming up in just a couple weeks, and I'm excited about that. Geofencing is the topic of the day, and that probably sounds like a big, weird concept to a lot of people out there, but I think they're going to get a lot of value out of it. So
Yeah, no, that's going to be good. I'm looking forward to it. There's a great short story, and the kind of the moral of the story is don't remove fences until you know why they're there. I
nice.
was thinking about that. You know, good fences make good neighbors, and fences make good marketers. And there's a reason to do that. You know, it's not just you're not just fencing people in. You're connecting with the right people at the right time in the right place, and
Exactly.
that's beautiful marketing. So I'm excited to talk with you about that.
Exactly right. Well, thanks a lot, Steve. I really appreciate it.
Thank you, David. Talk to you soon.
All right.